In 2018, Michigan voters elected a new governor, Gretchen Whitmer. In its new series, Inside Michigan Government, the Michigan Advance will be sitting down and talking to leaders of key state departments about what they do, as well as problems and solutions for Michigan.
My name is Robert Gordon. I've been the director of DHHS since January. I'm originally from New York. Have a long history in working to improve the quality and effectiveness of programs that serve the public, particularly individuals who are vulnerable. My first job out of law school was representing kids in abuse and neglect cases in the Bronx for the Juvenile Rights Division of Legal Aid. I then worked in the New York City Public Schools, designing a system aimed at providing funding more fairly and equitably and driving more dollars to students who most need help. I then worked in the Obama administration, designing home visiting programs, teen pregnancy prevention programs, programs to support investment and innovation in education, and again, to use evidence and data to do what works for people. After the Obama administration, I worked at the College Board for several years, and I've been incredibly delighted and honored to be serving Governor Whitmer and the state of Michigan. It was incredibly exciting to work in the Obama administration. I was there from the beginning when we were, working for a new, amazing, historic president, and also working at a time of deep crisis for the American economy. So I helped to drive out the recovery dollars that did a huge amount to bring the economy back. Also helped to set up, as I mentioned, new initiatives. It was a very smart, committed group of people working at a difficult time. It was an honor. Yeah, so it's worth stepping back. Healthy Michigan Plan was a wonderful bipartisan achievement. Medicaid was expanded in Michigan under a Republican governor with a Republican legislature. And because of that expansion, 680,000 more Michiganders have health insurance. They are getting more primary care. They are visiting the emergency room less. It has created tens of thousands of jobs in this state. It has added billions of dollars to the economy in Michigan. So it is a tremendous success. The work requirements emerge from a goal that everyone shares, which is to foster independence for people when we can. But they do create tremendous risk that people will lose health insurance. And an independent study looking at the experience in Arkansas and applying it here found that somewhere between 60 and 180,000 people could lose their health insurance. I think that would be a devastating outcome for the state and for the people of the state. So we are working to ensure an implementation that is as smooth as possible, and we'll do everything in our power to do that. But at the same time, we're asking that the legislature make some changes to improve the implementation and make it as smooth as possible. And Governor Whitmer has spoken about that, and I've spoken with legislators in both parties about that. As for how the work requirements will work, if you are required to report, there will be a monthly reporting requirement, and there will be an opportunity to call in, or there'll be a website. There'll be both. As I said, we're trying to learn lessons from what happened in Arkansas, which was not a successful implementation, so we don't repeat the mistakes there, and we're doing everything in our power, but there are some things that are not in our power. There are simple things that would improve the implementation of the statute. So for example, in Arkansas, people who were working were not required to report if they were working, because the state knew from employer-provided data that they were working and compliant. The way the statute was written here, and I think this was just an oversight, reporting would be required. We'd like to change it to make it work the way it worked in Arkansas. That's a very simple change that would reduce the number of people who have to call us every month and increase the number of people who are doing everything they're supposed to be doing and also keeping their health insurance. Yeah, I mean, as terrible as the tragedy in Flint was, I think if you look at what's happening now, it's a source of hope. You do have folks from every sector of the community coming together, working with local public health, working with us, working with folks nationally to improve outcomes for the kids who were affected. And I think that there is great hope in that. We've continued the work that happened in prior years that goes on. We continue to focus on water quality, so there remains work to do. I think in a lot of ways, we have to think about Flint, and we have to think about the kids across the state who face similar challenges. I would love to see us deliver services to families and children in Michigan in a way that is as dignified and humane and efficient as possible. I think we often forget that we are working with people at very difficult times in their lives, and we want to do everything we can to treat them with humanity. I think sometimes we do that very well, and sometimes we do it less well. So that's a big focus of mine. I would love to see the services that we provide not just help people get by, but also help them to get ahead, sort of to move from the safety net concept to a springboard concept. I think we can and should be working to reduce poverty in Michigan, and we have the opportunity to do that. I would love to see us in our children's services programs helping more children to stay safe, helping more children to stay with their families rather than come into our care, and to do that safely, and helping more children achieve permanency, ideally with their families, as quickly as possible. I think we can do that. I would love to see us increasing our emphasis on prevention, so moving upstream, reaching people before they're in the emergency room. And I think that's a goal to be achieved throughout individuals' lives. When we're talking about infants and reaching moms when they're pregnant and providing them with the support and the knowledge and the information they need to do what they want to do, which is to do right by their kids. That's something that can lead us to have healthier babies, more opportunity, and even less cost for the state. And I think those same principles apply at the end of life as we're talking about older Michiganders and providing them with the opportunity, if they want, to stay in their home, to stay in their community with their loved ones, and to live independently as long as they possibly can. So I think those are all goals that we can make headway against here in Michigan. Yeah, it's a good question. I think I'm excited. We have a wonderful array of home visiting programs in Michigan. There are several that are all around the country, and then we have the MIHP, the Homegrown program, which is, I've had wonderful visits with providers in that program, really extraordinary people. I think there's an opportunity to foster more cross-fertilization, more learning across programs, so that we have, as much as possible, we provide an array of opportunities to support families of different kinds. Yeah, I think having a department this big is challenging, but I also think it's a huge opportunity. And every day we have a conversation about a program, two programs where in another state they're in different agencies, but in our state they're in one agency, and we can foster cross-fertilization. So I was just talking about home visiting, and we should leverage home visiting as much as possible to reduce the need to take children away from their parents in children's services. Those could be two separate agencies. They're one agency with us, and so that's a great opportunity. So it is hard, but I also think it's an opportunity we really want to leverage.